So today we're diving into a really powerful idea in data science. It's this ability to find answers to questions that honestly we didn't even know we were supposed to be asking. It's a concept that is totally changing the game for everything from public health to brand new scientific discoveries.
All right, let me just start with this question. What if the most important, most critical pattern in a huge public health crisis isn't something we're actively searching for? What if it's just hiding there, in plain sight, waiting for a completely different way of thinking to come along and find it?
Okay, picture this. It's a real-world scenario from the peak of the COVID-19 pandemic. Hospitals are just flooded and they're looking at thousands of patients and they all have the exact same diagnosis, severe pneumonia. From the outside, it looks like every single one of them is fighting the exact same battle.
So researchers gathered a mountain of data, all the clinical and lab results from over 2,000 of these patients. But here's the twist. Instead of going in with a specific question, like, does this drug work, they tried something different. They just gave the data to the machine and basically said, you tell us, what patterns do you see?
And what came back was, wow, it was astounding. The algorithm found 6 totally distinct groups of patients, or phenotypes, that's just a fancy word for their observable traits, hiding inside that one single diagnosis. So what looked like one disease was actually 6 different versions of it.
And this wasn't just some academic exercise. No, this had literal life or death consequences. It turned out the patients in one of those hidden groups had a mortality risk 6 times higher than patients in another group. Same diagnosis, totally different outcomes. And the craziest part, no one told the algorithm to look for these groups. It just found them, all on its own.
And that right there, that ability to find the complete unknown, is powered by something called unsupervised learning. You can think of it like a discovery engine. And today, we're going to pop the hood and see exactly how it works.
Okay, so let's break this down. Unsupervised learning, in the simplest terms, is when you let an algorithm just wander through your data without any pre-labeled answers. You're not telling it what's right or wrong. Its whole job is to just find the hidden structure, the patterns that we, as humans, would probably miss.
So this is the most important distinction you need to get. Think of it like this. Supervised learning is all about predicting things. You show it a bunch of examples with the right answers and say, okay, learn from this so you can predict what's going to happen next. But unsupervised learning, that's about discovery. You give it a pile of raw data and just say, tell me something I don't know. We're going to walk through the 3 main families of these discovery tools that are so important in public health. First, clustering, which is all about finding hidden groups. Then, dimensionality reduction, which helps us see through the noise. And finally, anomaly detection, which is how we spot the totally unexpected.
All right, first up, clustering. This is probably the most common unsupervised technique you'll see in public health, and it's all about answering one fundamental question. Are there meaningful subgroups hiding in my data that I'm not seeing?
Let's look at a couple of the big ones. You've got k-means clustering. It works by grouping data around a specific number of center points. This is perfect for things like, you guessed it, identifying those patient phenotypes we talked about earlier. Then there's another really cool one called dbScan, which groups things together based on how close and dense they are, and that makes it amazing for finding things like disease hotspots on a map.
And this is where it gets really powerful. So imagine emergency rooms start seeing a little uptick in people with respiratory symptoms. dbScan can look at where those people live and automatically see if the cases are bunching up in a specific neighborhood, flagging a potential outbreak way before any human has connected the dots. Okay, let's move on to our second family of tools, dimensionality reduction. Look, public health datasets can be absolutely enormous, right? You might have hundreds of different variables for every single person. How in the world are you supposed to make sense of all that noise? So let's say you're studying how the environment affects health. You could easily have 50 different variables for every single community. Things like air pollution levels, water quality reports, access to parks, you name it. Trying to analyze all of that at once is it's a nightmare.
This is where dimensionality reduction comes in. A technique like principal component analysis, or PCA, can take all of that messy information and compress it. Basically, it finds the most important underlying patterns and bundles related variables together. So it might distill those 50 variables down into just 5 core risk profiles that are actually understandable and, more importantly, actionable.
And when you do this, the results can be just groundbreaking. Researchers using these exact methods in precision medicine found they can uncover new types of diseases and new biomarkers that were, and I'm quoting here, invisible to conventional analysis. That's what happens when you can finally see through the noise.
Now for our third and final technique. And honestly, this one has some of the highest stakes in all of public health: anomaly detection. This is all about spotting that one truly unexpected event before it spirals into a full-blown crisis.
The core idea here is actually pretty simple, but it is so powerful. You train a model on what normal data is supposed to look like. Say the usual number of ER visits for flu-like symptoms in the middle of July. Then, the model's only job is to basically scream and wave a red flag the second it sees anything that doesn't fit that normal pattern.
And there's an amazing study from Sweden that shows this in action. Back in early 2020, one of these unsupervised models detected a really weird spike in symptom data coming from a public health hotline. It was weeks before the traditional surveillance systems finally confirmed the first official COVID-19 outbreak. This thing was a true early warning system.
Okay, so we've seen how these tools can find hidden groups, how they simplify complex data, and how they can spot anomalies. So now let's talk about the big question. How do you actually use this incredible discovery engine in the real world?
And this brings us to something really important. I mean, if this unsupervised learning stuff is so powerful, why do so many public health teams just skip right over it and jump straight into making predictions?
Well, it turns out there are a few pretty big roadblocks. First, there's a training gap. Most biostats programs are all about teaching you how to test a hypothesis you already have, not how to find a new one. Then there's some tooling challenges. And finally, you have the culture of how research gets funded, which tends to love the certainty of prediction way more than the messiness of exploration.
But here's the workflow that really combines the best of both worlds. You start with unsupervised methods. You just explore the data, see what hidden patterns you can uncover. That exploration, that's what generates brand new data-driven hypotheses, ideas you never would have even thought to look for. And then, this is the key part, you use your traditional, rigorous scientific methods to actually test and confirm those hypotheses. See, it's not about replacing science, it's about making it smarter. And that brings us right back to where we started. So which is more important? Answering the questions we already have, or discovering the ones we didn't even know we needed to ask? In public health, the answer has to be both. And unsupervised learning is the key to finally balancing those scales. If you found this explainer helpful, please hit that like button and subscribe for more deep dives. We'd love to hear what you think in the comments. Thanks for watching.